Hello, Professor Mick, Chairman Sylvia Wallace here. So I'm going to try and see if I can make this video less than 10 minutes. I know I've been having a longer video. So my exemplar today is about hypertension. Now, hypertension is another name for high blood pressure, high BP. That's what I'll be referring to it throughout the duration of this video. So high blood pressure on its own is the force that the blood exerts against the wall of the blood vessels. Now this pressure depends on the resistance of the blood vessel and how hard the heart needs to work. In the US, more than half of the population have high blood pressure but are not aware of this. Hypertension is a primary risk factor for cardiovascular diseases. This can include stroke, heart attack, heart failure, and aneurysm. Now, for my patient, my medical diagnosis, we're going to start with 4 categories of blood pressure. We have the normal blood pressure, which we know is about 120/80. Then we have elevated blood pressure. Now this is just a little bit spike, and this can range from a systolic pressure of 120 to 129 and a diastolic pressure of 80, anything below 80. Now for the third stage, we have stage 1. For the third part, we have stage 1 hypertension. Now the systolic pressure is about 130 to 139, and the diastolic pressure is about 80 to 89. For the final level, we have stage 2 hypertension. Now this stage is the extreme case, and for this we'll be seeing a systolic pressure of 140 and above, and a diastolic pressure of 90 and above, which is really bad. For our assessment, I am going to be also using Mr. Wallace over there. So I am going to ask Mr. Wallace some questions, some historical questions, which will include family history, any history of high blood pressure in the family, any hereditary diseases or conditions that could be contributing to this. I will also find out Mr. Wallace's exercise routines, his dietary routine as well, and also social and work habits, which can include working longer hours, lots of social mingling, which could include smoking and drinking. All this would also help me in my diagnosis. So I'm going to also ask you, Mr. Wallace, I'm going to record your blood pressure, and I'm going to do this more than once, say 3-4 times in different appointments. This is because blood pressure can differ within different times of the day, so we need to catch all the different times and their readings as well. Also, your blood pressure might be spiking due to what we call white coat hypertension. This is just when people get nervous. Somebody like me, I get nervous when I go to a hospital. This could be another reason why your blood pressure may be spiking at some particular time. Now for our lab diagnostics, we're going to get some blood tests, which includes measuring your electrolytes, your blood urea nitrogen, and your creatinine level. This will show us if your kidney is involved after the diagnosis, if the high blood pressure has already affected your kidney. Now we're also going to measure your lipid profile, and of course the this lipid profile is going to also show us the cholesterol level, and which is a very high risk for high BP. And then the major tests will include electrocardiogram, and this will just show us the electrical activities of your heart. and this will be recorded, and it will also show us if there are any damages to your heart or your heart walls and arterial walls. We also may perform Doppler ultrasound. This will be used to check the blood flow through your arteries and at pulse points, which will include your points at the arms, your legs, and your feet. This will also help us to detect any vascular disease, which is common with high blood pressure. And we may also get an ultrasound for your kidney, like I mentioned before. This may have already affected your kidney, so we want to make sure what damage we are looking at or if we can rule it out. Now, for this disease, we also have potential or actual complications during the treatment for this disease. So complications from this high blood pressure, this can include anything from damage to your arteries, which is narrowing of your arteries, damage to your heart. Your heart may be enlarged due to the left ventricle overworking itself to overcompensate. Also, we may be seeing some damage to your brain, which can cause mini stroke and disrupt blood supply to your brain. This would be very bad. We are also going to, we may be seeing the damage to your kidney, which I mentioned before, and due to lack of healthy blood vessels that will help push out that excess fluid that the kidney, which is the kidney's function. Now, we may also see damage to your eyes, which because of this high BP, the tiny delicate blood vessels in your eyes may end up being constricted and damaged. We may also see, or you may also experience some erectile dysfunction during this period. This is because the blood supply there's a high pressure the blood vessels carrying blood to your penis region. So about the medications, so Mr. Wallace, there are several medications we can use to manage this disease. This includes diuretics, which an example is a metolazone. This is also called a water pill. This helps your kidney to remove excess sodium from your body and helps the blood vessel to hold more fluid. Now we have another medication called beta blockers. An example is betaxolol. This makes your heart slow. It slows your heartbeat. That way there will be less pressure on your heart to pump blood. We also have calcium channel blockers. An example of this is felodipine. This will relax your blood vessels and allow the blood to flow normally. We also have another set of drugs, angiotensin converting enzyme inhibitors. So they convert the enzymes and turn them into inhibitors. An example is valsartan. This will also relax your blood vessels and allow the blood to flow normally. Then I'm going to also mention vasodilators. This is a maybe, but in rare cases it can be used. An example is minoxidil. This signals the muscles of the heart to relax, thereby relaxing the vessels as well and allowing the blood flow. So side effects of these drugs can include anything from cough to diarrhea to constipation, and you can also experience dizziness, lightheadedness, and you might also be feeling drowsy, like you're complaining of headaches, and even some of them might end up making you feel nauseous and can even throw up. Also, you may experience some weight loss, and of course I've mentioned before about having some erectile dysfunction issues. Now, for me, how I'm going to help you, my nursing intervention is going to include, I'm going to make sure I'll be around to monitor your vital signs, which is very, very important in this case. This will include your heart rate and also your pulse, and I'm this pulse is especially going to be about apical and peripheral pulse. And also I'm going to also monitor your blood pressure constantly, and of course there's the ECG here, which is going to be on, and I'll constantly monitor it as well for any changes in the electrical functions of your heart. Now I'm going to also monitor your glucose level, because this is a high risk for high blood pressure. And also I'm going to make sure I constantly check your eye function in case the drugs and also the disease is having a more serious effect or damage to your eyes. I'm also going to focus on lowering and controlling your blood pressure, and I'm going to also be laying a therapeutic regimen for you. This will include exercises. I'm going to notify the dietitian to have a talk with you and see about changing your diet, something that you can easily manage. Also, I'll be recommending some psychologists if you also need some therapy sessions. I'm also going to help see a way we can help you cope some of the social actions that will affect you adversely with this disease, which can include your smoking and your excessive alcohol drinking. I'm going to work with you to see about lowering those things that will help you get better. So this concludes this exemplar, and Mr. Wallace, at this point I will ask you if you have any questions. I'm also going to educate you on high blood pressure, the treatment, extra treatment you may need, the exercises, or any questions you have at this point. You can always ask me. If you have any questions that you also need to ask someone above me, and I can also help set that up as well. I hope I was very clear, and of course you can always use your call bell if you have any more questions from us. Thank you so much. Bye.